One of the biggest things that we see when treating the shoulder is actually failing to treat the actual position of the glenohumeral joint. So when someone comes in to see me with shoulder pain or even neck pain, thoracic pain, a lot of what we'll assess is the position of what we call the humeral head, or where the arm comes and meets the shoulder blade. When I feel on the front of my shoulder, on the front of this model, I shouldn't be able to catch the front side of that humerus. If I can, then I know that it's sitting too far forward. What that can do is cause some compensations in terms of how the muscles are used. It can even cause some pinching into the shoulder, what we call impingement syndrome. The other thing that we look at with any sort of overhead movement is that the scapula actually has to help with that movement and go into upward rotation. A lot of our overhead athletes, throwing athletes, if they sustain some sort of a shoulder injury, they may actually lack that upward mobility of the scapula. And what happens when that occurs is that when you go to raise the arm up, your humerus is basically running into the ceiling of the shoulder. And that scapular upward rotation kind of helps open that shoulder up to provide a lot more range of motion. So you're not getting that pinching. You're able to go back to some of those activities that you want to do, whether that's throwing, golfing, any sort of upper extremity lift, that sort of thing, without having that continued pinching in the shoulder. Treating the position of the humerus is vitally important, but also other intrinsic movements of the shoulder, whether that's the humeral depression, abduction, internal, external rotation, all those play into how our shoulder and our upper extremity move.